Pakistan's geographic location next to Afghanistan, the world's largest producer of illicit opium, places the country in a vulnerable position in terms of drug trafficking as well as drug abuse. According to UNODC World Drug Report 2010, the world uses and seizes over 5,000 tons of opium every year, while Afghanistan produces 90% of this total demand. Out of this, 40% is transited through Pakistan. Afghanistan is also the largest cannabis-producing country of the world, and part of it is also trafficked through Pakistan. Apart from this, precursor chemicals needed for preparation of drugs from other countries to Afghanistan are also smuggled through Pakistan as mislabeled consignments.
Pakistan actually is facing a bigger problem than the rest of the world. We are a major transit route for Afghan drugs being trafficked to the Middle East, the Americas, the Far East, and the rest of the world. And the spillover effect of being a transit country is taking a very heavy toll on our country. Our problem, therefore, as compared to the rest of the world, is much more complex and grave.
The counter-narcotics efforts of the government of Pakistan are led by the Anti-Narcotics Force, popularly known as ANF. The first anti-drug setup in the country, Pakistan Narcotics Board, was established in 1957. Later, in 1973, it evolved into Pakistan Narcotics Control Board. An anti-narcotics task force was established as a parallel entity in 1991, and finally in 1995, both were merged to create ANF.
Has been fighting the menace of drugs. To this end, the policy of 1993 was revised in 2010. This policy envisages establishment of an interagency task force with a view to harmonize efforts of all law enforcement agencies. It also declared Lahore as drug-free city, which demonstrates the political will of the government and will also ensure participation of the people of Pakistan. A 5-year plan was also announced in 2010, which will terminate in 2014. Let me mention here, the key task of ANF is to conduct strategic interdiction of the drugs which are moving from Afghanistan through Pakistan to the rest of the world. Though this force is lightly deployed on the ground, but our strategic seizures in the past have always maintained Pakistan's position internationally amongst the first 4 countries in seizing opium, heroin, hashish, and other drugs. We have also conducted last year many controlled delivery operations, and because of all this, our international stature is very pronounced.
As defined in the National Anti-Narcotics Policy 2010, ANF pursues a 3-pronged strategy which comprises drug supply reduction, drug demand reduction, and international cooperation. Drug supply reduction focuses on identification of drug trafficking routes, prevention of drug trafficking, poppy eradication, enforcement of precursor control regime, prosecution, and assets investigation. On the west, Pakistan is sharing its border with Afghanistan and Iran. The length of border with Afghanistan comes around to 2,538 kilometers, out of which 1,300 kilometers is opposite Khyber Pakhtunkhwa and remaining with Balochistan. The border with Khyber Pakhtunkhwa is porous with numerous frequented and unfrequented routes which are difficult to monitor effectively. Whereas border with Balochistan is rather open, which is suitable for large vehicle traffic. The major drug trafficking from Afghanistan into Pakistan takes place through the unfrequented land routes, and the drug traffickers fully exploit the complex nature of the terrain. Volume of vehicles passing on a daily basis through the Torkham Pass and the Pak-Afghan border is 800 to 1,000 vehicles in one day. Chaman border in Balochistan with a little less but hard to manage number of 250 to 300 vehicles passing per day. In addition, thousands of pedestrians cross border every day from both sides.
देख रहे हैं कितना रश है, कितनी गाड़ियां आ जा रही हैं, तो इसमें हम इन को भी चेक करते हैं, आउट को भी चेक करते हैं। तो इसमें हमारे लिए मसले मसाइल इस तरह हैं कि एक तो एक्सरे मशीन नहीं है कि कोई गाड़ी को हम मैनुअल तो हम चेक करते हैं, अपनी पूरी जान मारते हैं। हमारे पास कोई मशीन नहीं है, लेटेस्ट इस तरह मशीनें हैं बाकी मुल्कों में कि वो हमें अगर वो प्रोवाइड कर सकें तो इससे हमें आसानी होगी।
Pakistan shares 909 kilometers border with Iran. Openness of terrain on both sides of the border and its proximity to Pak-Afghan border makes it a favorite with drug smugglers. Coastal belt is 1,062 kilometers long and is inadequately covered by the law enforcement agencies. One of the most common conduits for trafficking heroin is the aerial route. To impose strict check on this mode of trafficking, ANF focuses on all international airports and flights. Approximately 13,000 passengers and 70 flights are departing daily from different airports of the country for about 50 destinations. In the years of its presence, ANF conducted several successful operations at the airports, leading to the arrest and prosecution in thousands of drug traffickers, including hundreds of foreigners. ANF also monitors the Hajj operations every year with the Civil Aviation Authority to control the smuggling of narcotics to Saudi Arabia. Other sensitive points of entry and exits are sea and dry ports. Special attention is paid to check for smuggling of drugs and precursors through these ports. Volume of containers passing through seaport per day is over 1,300. Additionally, all the inwards and outwards consignments through various private national and international courier services are being scrutinized. Peak poppy cultivation in Pakistan was in the year 1992, which was around 9,000 hectares. After the establishment of ANF, Pakistan, in 2001, was able to achieve the status of poppy-free country. In order to destroy poppy crops, every year during harvesting season, a concentrated effort is launched in poppy-growing areas of Khyber Pakhtunkhwa, Balochistan, and other parts of the country. As part of its pledge to work towards a drug-free Pakistan, ANF holds official drug-burning ceremonies regularly each year. To ensure speedy disposal of narcotics cases, 6 special courts, CNS, are functioning exclusively for the trial of counter-narcotics cases. Conviction rate stands between 88 to 91%. In the process, vehicles and properties worth $63 million of the convicts have been so far frozen and forfeited and auctioned in Pakistan. ANF's drug demand reduction strategy revolves around awareness, community participation, treatment and rehabilitation, and harm reduction. one of the countries hardest hit by narcotics abuse in the world. According to national drug abuse surveys, the number of chronic abusers of heroin increased from about 20,000 in 1980 to more than 1.5 million in the late 1990s. Currently, the estimated number is around 5 million. In the last 50 years, Pakistan has seen a change in drug usage patterns at least thrice. Abuse survey conducted so far indicates that number of drug users is increasing at the annual rate of 7% in Pakistan. Out of the estimated 5 million drug users in Pakistan, around 0.628 million are opium users. 0.124 million of these are IDUs, contributing to the spread of HCV, HIV, and AIDS. Majority of drug users are in the age bracket of 15 to 34. From low income, it spreads to middle to high income groups, especially among the youth. The most recent change occurred with the entry of amphetamine-type stimulants like ecstasy and cocaine, especially in the youth of higher socioeconomic strata. The drug abuse problem is multifaceted and affects every aspect of society. ANF has therefore attempted to develop a comprehensive plan of prevention engaging significant segments of society like the media, religious and voluntary organizations, schools, healthcare providers, and law enforcement agencies. Major activities include conducting research and surveys, maintaining a liaison with NGOs and CBOs nationally and internationally. Community participation in drug demand reduction, including lectures, workshops, cycle races, debates, declamation contests, and sports. Creating mass awareness using media and entertainment programs like drama serials, talk shows, telefilms, and musical programs. Prevention as part of drug demand reduction attempts to prevent the occurrence of a drug problem. 2 projects are currently in process. Prevention also aims at treatment, rehabilitation, and social integration plus harm reduction. Model addiction treatment and rehabilitation centers, MATRCs, have been established, one in Islamabad, another in Quetta, and third in Karachi. Provision of free of cost treatment as per international protocol with a 15 days detoxification and a 30-day rehabilitation exercise are ANF's main demand reduction tasks. Till date, thousands of drug addicts of all ages and gender have been successfully treated and rehabilitated by these model treatment and rehabilitation centers.
नशे के दौरान मेरी ज़िंदगी गैर मुनज़्ज़म हो चुकी थी और जब मैं नशा करता था तो मेरी ज़िंदगी जो थी बहुत सारी बदनज़मियों का शिकार थी और जब मैं यहाँ इलाज में आया हूँ तो यहाँ मुझे ज़िंदगी की कदर कीमत का पता चला है.
2 drop-in centers for injecting drug users have also been established at Rawalpindi and Quetta, where drug addicts are provided with necessary first aid to protect themselves from harmful effects of addiction. At the same time, counseling and guidance is provided to them and their families to control the epidemic of HIV/AIDS and other blood-borne diseases. A pilot project for treatment for drug addicts in Adiala Jail, Rawalpindi by establishing a 10-bed detoxification ward has been launched by ANF since March 2010. A team comprising of a psychiatrist, a medical officer, a psychologist, and motivator from MATRC Islamabad visits the facility regularly. A large number of patients have been detoxicated and reverted to normal life. Plan to establish a complete treatment and rehabilitation center equipped with all the facilities and staff is underway, for which national and international help is required. Every year, June 26th is celebrated as World Anti-Drug Day. Messages and activities are conducted nationwide to remind the public at large about this menace. Ultimate success is not possible without the sustained support of global partners in war against the drug menace. ANF, as third prong of the strategy, pursues a very active international cooperation stratagem through which commitment towards international obligations as part of common and shared responsibility is exhibited. MOU and treaties have been signed with 28 world countries. ANF is actively involved with UNODC, INCB, Interpol, NAS, FANC, and DLOs.
course, the phenomena of drug trafficking is a worldwide menace, and we're here to play our part in that regard. We have had a number of successful investigations of transnational crime syndicates operating between Afghanistan, Pakistan and Australia.
Nothing is possible if the execution lacks perseverance. The crux of the matter is that whatever ANF has achieved is solely due to the hard work, dedication, and resilience of its force. The ANF officer on street knows that he is not just fighting crime, but is saving precious lives of humanity, which may include his own present and future generations. It takes courage to join any force, but it takes sheer determination to join the anti-narcotics force. To maintain the force as vibrant, dynamic, and a robust body, each member is selected through a deliberate and merit-based selection process, then is put through strenuous training process. The fresh inductees are put through basic training of 6 months, which transforms them from civilian youth to uniformed law enforcers, besides enabling them to handle all possible situations at the ground level and also help them to create solutions on the spot for any unexpected situation. Trainees who successfully complete their basic training have a passing out parade to formally announce the start of their official responsibilities at ANF, with a pledge to make Pakistan a drug-free country.
Despite all I've said about the achievements of ANF, you all know that the society is increasingly getting proliferated with drugs, not only in Pakistan, but the world over. So what is to be done? We have all to join hands against this menace. It's not for a force or agency to do it alone. We have to work together. It's like global warming. It's coming. If we don't join hands together today, it's going to destroy our generations to come.